Welcome to today's lecture on Terson syndrome. We will cover its causes, symptoms, diagnosis, treatment, and prognosis. We'll also discuss its occurrence in specific populations and the role of advanced imaging techniques. Let's start exploring this interesting topic. Terson syndrome is intraocular bleeding caused by subarachnoid or intracranial bleeding, commonly seen in traumatic brain injury. Factors like severity of trauma, subarachnoid bleeding, and raised intracranial pressure increase the risk. Anatomical factors like hemorrhage size, location, and arterial/venous integrity also play a role. Intraocular hemorrhage in Terson syndrome is caused by hemodynamic changes due to subarachnoid or intracranial bleeding. Elevated pressure impairs retinal venous drainage, leading to stasis and vessel rupture. The specific mechanisms are being studied but likely involve increased venous pressure, decreased arteriovenous pressure gradient, and changes in the blood-brain barrier. Terson syndrome can cause sudden visual loss, floaters, visual field defects, and ocular motility problems. Diagnosis can be challenging due to overlap with other brain injury effects. Thorough neuro-ophthalmic evaluation is necessary, including fundoscopy, OCT, and visual field testing. Differentiating Terson syndrome from other causes of intraocular bleeding is crucial for proper treatment. When Terson syndrome occurs in the context of subarachnoid hemorrhage, early and accurate evaluation is crucial to determine the severity of both the ophthalmic and neurologic conditions. This involves comprehensive neuroimaging, lumbar puncture, and visual assessment to guide appropriate management decisions. Prompt surgical intervention may be warranted in cases of vitreous hemorrhage or retinal detachment, whereas conservative management is often sufficient for milder forms of Terson syndrome. Optical coherence tomography, OCT, has emerged as a valuable tool in assessing the retinal pathology associated with Terson syndrome. By providing high-resolution cross-sectional images of the retina, OCT enables visualization of retinal layer abnormalities, subretinal fluid collection, and the extent of hemorrhage. This non-invasive imaging modality aids in diagnosing and monitoring the progression of Terson syndrome, as well as evaluating the effectiveness of therapeutic interventions. Severe cases of Terson syndrome may require surgical intervention to address complications such as vitreous hemorrhage, retinal detachment, or macular hole formation. Vitrectomy, a surgical procedure involving the removal of vitreous gel and associated blood, can restore retinal anatomy and improve visual outcomes. However, the decision to proceed with surgery should be based on careful consideration of the patient's overall systemic and ocular condition, as well as the potential risks and benefits associated with the procedure. Terson syndrome can cause visual field defects, affecting peripheral and central vision. Severity and location vary based on hemorrhage. Visual field testing is important for functional assessment and rehabilitation. Understanding these effects is crucial for patient care. Prognosis and visual recovery in Terson syndrome depend on multiple factors, including the severity of retinal damage, promptness of intervention, presence of associated neurologic sequelae, and the patient's overall health status. While some patients experience significant visual improvement following appropriate management, others may suffer permanent visual impairment. Long-term follow-up is essential to monitor visual outcomes, address potential complications, and provide rehabilitative support to maximize the patient's visual potential. Terson syndrome can occur in pediatric patients, and its clinical presentation may differ from that in adults. In pediatric cases, Terson syndrome is often associated with non-accidental head trauma or shaken baby syndrome. The management of Terson syndrome in this population requires multidisciplinary collaboration, including child protection services, neurologists, ophthalmologists, and social workers, to ensure accurate diagnosis, appropriate intervention, and the well-being of the child. Emerging evidence suggests that genetic and familial factors may contribute to the development of Terson syndrome in certain individuals. Molecular studies have identified potentially relevant genetic variations that could affect the integrity of retinal vessels or predispose individuals to retinal hemorrhage. Understanding these genetic and familial factors may have implications for early screening, genetic counseling, and personalized management approaches in individuals at risk of Terson syndrome. Advances in imaging techniques and the identification of biomarkers hold promise for early detection and diagnosis of Terson syndrome. Techniques such as wide-field fundus photography, fundus autofluorescence, and angiography provide valuable insights into retinal changes associated with Terson syndrome. Furthermore, the identification of specific biomarkers in blood or ocular fluids may serve as diagnostic and prognostic tools, facilitating early intervention and improving patient outcomes. To consolidate our understanding of Terson syndrome and the complexities surrounding its diagnosis and management, we will analyze a series of challenging clinical cases. These cases will highlight the diagnostic dilemmas, therapeutic considerations, and long-term outcomes encountered in the management of Terson syndrome. By studying these real-life scenarios, we aim to enhance our clinical acumen and provide insights into optimizing patient care in complex situations. Terson syndrome is a complex eye condition that requires a comprehensive approach for evaluation and treatment. By understanding its causes, symptoms, diagnosis, and treatment options, we can improve outcomes and quality of life for those affected. Ongoing research and advancements offer hope for better detection and management in the future. Thank you for joining me on this journey.